Bobby, what's the first step after blood draw?
We're going to draw your blood. We are going to put it in the centrifuge right over here, and then we're going to spin that down, and that's going to turn your blood into the red blood cells on the bottom, and then the platelet and plasma on top. So
Okay.
once we get that, we will take the plasma portion off the top into the syringe, and we'll inject that into the area of need, in this case, the knee.
So I've had knee issues for years, and as of late, my knee has been basically feeling like it's sliding out of joint. So it will lock up on me and I can't extend it all the way. So we're going to do some PRP is what it's called. And we're going to see the effects of it. So blood was drawn. I skipped that part just in case there was any queasy people.
So we've got our blood. We're going to put it in the centrifuge.
And that spins for how long?
It'll spin for about 13 minutes.
And then that basically moves platelets around, moves blood cells around.
The red blood cells are the most dense part of the blood. So because of that, it will go beyond the gel barrier and settle down to the bottom of the tube. The less dense portion, the plasma, the platelets, the growth factors, will be on top. So that's what we'll use to inject.
In layman's terms, we're taking the good stuff and putting it up top and reinserting it so your body can, or in this case, my body can use it. All right, so this is the finished product. This is what we pulled out of the, what is that machine called?
That's a centrifuge.
Centrifuge.
Yep, and this is what we're pulling up.
As the injection began, they started with a cooling agent on the skin, and so I didn't even feel the insertion. It felt like a little bit of a push. Now, the injection speed is controlled by the nurse practitioner, and as I communicated with Bobby at first, it felt a little bit intense, but he was able to back off, and I barely felt anything. It just felt like somebody was pushing slightly and squeezing my knee. Okay, so we just finished the injection, and I've got a few more questions for Bobby before I step out of the office. Movement, am I okay to move around on it?
Yes, absolutely. Please do move. You don't want to do nothing on it. That'll help it make it stiffen up. Moving it around moves the fluid around in the joint so that you actually get better faster. That being said, don't go excessive. Don't go out and golf 18 holes or go lift heavy weights or something like that. Just do your normal everyday stuff. Also, avoid any sort of NSAID like ibuprofen, Aleve. Anything like that is going to decrease inflammation, and that's not really what we're looking for in this situation. Tylenol is fine for you to take if you do have some discomfort, and it's very normal to have a little more discomfort the next 1 to maybe 3 days afterwards because we are increasing inflammation. So if you're a little bit more sore the next day, very common, very normal, nothing to panic about.
Okay. And the science behind this, like when we increase the inflammation, that allows the platelets and everything like that to get into where it needs to go, all the cracks and crevices.
The way that I like to explain it is that platelets are part of what clot your blood, right?
Right.
But it's also the beginning of a messenger system. So you cut your arm, it starts bleeding, the platelets go there to stop that bleeding. But it's the very beginning of the messenger system of healing. So it's sending out all these different signals to, hey body, I got damage here, come in here and start healing. So all we've done is concentrate that and inject that into the damaged area.
So we're just putting a jump pack on it, basically.
Yes.